Utterly shameful. Freaking ridiculous. Because I don't get freaking experimental vaccine jabbed in me, they're gonna freaking fire me.
Come on, you gotta go out. Then you report it in the
Ridiculous. Yeah, it's called a public place. No.
Get out.
No.
Do you want to get arrested?
Yeah, sure.
Put that out.
No. No. Excuse me, what are you doing?
Put that out.
No. Why are you assaulting me?
You need to leave.
Why are you assaulting me? I didn't assault you. I did not assault you. Why are you assaulting me, sir? Why are you pushing me? Don't touch me.
An alleged respiratory therapist refused the vaccine and, well...
Don't touch me.
The subject is recording. He's refusing to.
Amendment right, sir, to record. Excuse me, give me my badge, give me my personal property back. Excuse me, what the heck is this? Is what happens when you stand up for medical freedom. Why did you assault me, sir? I was peaceful this entire time.
No, you're inside the
Why
hospital.
did you assault me?
You're causing a disturbance
Why
inside the
did
hospital.
you assault me?
You're affecting patient care.
You do not have the right to assault me, sir. You do not have the right to assault me, sir. I'm not blocking patient care.
Yes, you are.
Everybody can get
You
fined
are
just
being
fine.
disruptive to the patients that have a
there will
right
be a lawsuit,
to a peaceful.
sir. You have absolutely no right to assault me. I've never.
He wonders why, after causing a scene and blocking foot traffic, he's being removed from the premises of the hospital.
I'm in a public place.
This is not public.
This is a public property. It's a public easement, sir.
Okay.
I'm on public property. Right now, this is a public easement, and I'm on public property. Look.
That's correct, guy. Now you are. Previously, as you falsely claimed, you were not. Thus, you were removed.
I'm on a public easement. This is public property. If you touch me, surely there will be a lawsuit. Actually, there already will be a lawsuit. Okay. You assaulted me over there.
You're blocking patient care.
I am not blocking anything.
You should be a medical professional.
I am not blocking anything, sir.
Once you leave the facility, you can demonstrate out here as much as you want.
I am outside on...
Blah, blah, blah. This guy has no business being in the medical field. It is shameful. In September, ABC News reported that in North Carolina, the Novant health system had a vaccine compliance rate of over 99%, officials said. Mandate announcements really kicked into gear when the Biden administration made workforce vaccination a requirement for Medicare and Medicaid participation. Most health system leaders and professional organizations have been supportive of the requirement, with some describing vaccination as the logical fulfillment of the ethical commitment of all healthcare workers to put patients as well as residents of long-term care facilities first. Many will cry wolf for a myriad of reasons. However, some industry figures have pushed back on staffing fears. Ezekiel J. Emanuel, MD, Vice Provost for Global Initiatives at the University of Penn and a former White House health policy advisor, pointed to the limited workforce fallout among the summer's early movers as an acceptable loss for workforce-wide coverage. Quote, if you look at healthcare systems that have actually mandated this, they've retained over 99% of their workforce, he said in support of the mandates during an August presser. Their workforce does go along when the employer requires it. Ian Ross, a neurosurgeon, wrote an op-ed in the LA Times, which reads in part, by the time it was approved, the vaccine had been given to about 20,000 volunteers without serious incident. Now millions have received it. Other than a very small number of allergic reactions, which can be scary but are easily treated, 0 serious side effects have been documented. Some side effects may eventually show up from this or other COVID-19 vaccines, but that is part of the everyday practice of medicine. People react to anesthesia. Some are allergic to antibiotics. Others have issues with blood pressure and cholesterol medications. I could go on. COVID can mean death. Maybe not for you, but for someone you come in contact with and inadvertently infect. And if you work in healthcare, you may end up passing the virus to your sick patient who is more vulnerable to the disease. Yet some people who have chosen to care for the sick want to wait to make sure the vaccine is safe before they get it. These people who don't trust the man and think they can beat the virus on their own are selfish. Getting vaccinated against COVID is a civic duty. Making the choice to get vaccinated against the coronavirus shouldn't be only about what you want to do, especially if you work in medicine. If you don't trust medical research and the recommendations that come from the highest level of medical oversight and study, then what are you doing in medicine?